joint stability, regardless of the joint, whether it's your fingers, your hand, your wrist, or your elbow, dependent on three factors. And three factors are important to understand. Number one factor is the skeleton itself. The bones are comprised of ends of the bone which make up joints. And the joint has to have corresponding surfaces. One's convex to some degree and one's concave to some degree. And the way that they match up is wonderfully designed to provide stability. That's our number one factor, stability through skeletal support. Number two are ligaments. Ligaments run from one bone to the other, and their role is to add to stability. That's a secondary stabilizer. And number three are tendons. Tendons run from muscles to bone, and they provide even a third or tertiary stability program. Now, why is this important? Part of it is that each of these three elements can lead to problems that are difficult or easy to recover from. You talk about the joint itself and the skeletal alignment. Part of the problems are, unfortunately, as we age, the bones and the joints can at times become a little bit more misshapen, even earlier on than you get arthritis. And a pre-arthritic condition may lead to the edges of the bones, specifically at the joint, starting to wear and show signs of wear and tear, that the joint loses some of its inherent stability. It just doesn't fit quite as well as it did when you were 18 years old. The problem with ligaments is that ligaments cannot be strengthened. If a ligament runs from one bone to another bone, you can't make it stronger because there's nothing attached to it except the other bone. So once you have a ligament injury, with or without a joint problem, you may lead to a joint problem because the ligament gives a little bit less stability than it did when it wasn't injured. Now, the interesting part are tendons. Tendons are my favorite topic because tendons always give you hope. Tendons give you potential. Why? Because tendons are attached to muscles. Muscles can be strengthened. And as muscles strengthen, those tendons could be tighter in a way that that tertiary stability becomes a primary factor in your recovery. So with muscle strength, the tendon can become more taut, similar to water skiing. As the boat pulls harder, the rope is going to be tighter. So the more the muscles develop, the more tight the tendons will become, the more additional stability you will gain. Now, why is this important? It's important in the upper extremity because oftentimes patients are led to believe that just by playing golf, or just by playing pickleball, or just by playing tennis, they're going to be, quote, working out, and they already are athletic and active. Whereas the sport activity doesn't often lead to the conditioning of those muscles. It's more exercising outside of your sport, which is important for muscle development. So you may say, what's the best thing for me to be able to return to golf, tennis, or pickleball as soon as possible? It may be exercising in a way that has very little to do to actually playing golf or pickleball or tennis. More of going to a gym and with a trainer, or therapy with a occupational hand therapist or physical therapist, and working on stretching, strengthening, and conditioning. So those are the three factors that I think are the most important. A lot of people lose flexibility as we get older. It's just a nature of maturation. So if we are able to increase our stretch, we'll have a greater moment arm, which will allow us to move to a greater degree, therefore helping our tendons be pulled by the muscles more efficiently. So if you can work on several factors, working on stretching, working on strengthening, and working on conditioning your muscles, along with a good diet, good hydration, good night's sleep, and protecting yourself from injury, I think your longevity of playing sports is greatly enhanced.